Hello, this is Dr. X. I'm a doctor working here today. May I confirm your name and age, please?
Hello, doctor. My name is Jacqueline Fernandez, and I am 29 years.
Okay. May I know how may I address you?
Please call me Jacqueline.
Adeline. Okay. Adeline, today we are
Jacqueline.
going to discuss about Zadeline. Okay,
Jacqueline.
okay. Okay. And today we are going to discuss about your health issues. Will that be okay?
Okay, doctor.
During our discussion, I might take down some notes which will be strictly confidential. Is it all right?
No problem.
Okay. Can you please now tell me in your own words what have brought you here today?
Actually, doctor, I am facing this problem for last 1 year. That I had some shortness of breath and some chest tightness. And after that, I visited my GP. He thought that it is due to asthma, and then he gave me two inhaler. That is, one was salbutamol and another was fluticasone. I was using that. That was working so fine for me. And for the last 4 months, we have shifted to a new house at a village, and there I am facing the problem a lot. This doses for those inhalers are not working well, and also my mother had a heart attack about 4 months ago. So I am really worried that if it was, if it, for my case, if it is a case of heart issue or not, I am really afraid of that. And also that medication are not helping me as they helped me before. So I visited my GP, and after that he sent me here.
Yes. Okay. I'm sorry to hear, but we are going to try out the cause as soon as possible. Okay. Can you tell me that for how long have you been facing the shortness of breath and chest tightness?
For last 1 year, but that
Okay.
responded well to the medication.
Yeah. Well, that responded well. Okay. Can you please tell me that at the beginning, this shortness of breath, did it come along all on a sudden, or did it develop gradually?
Gradually.
Gradually. Okay. And did you okay. And did this shortness of breath persist for all the time,
No,
or anything?
I
Okay.
think it is more at night or at late night, and also in the morning.
Okay. And also in the morning. Okay. And do you think that there was anything special that made it worse other than this?
No, I cannot remember.
Okay. And you were told that you had some cough. Okay. Sorry, some chest tightness. Well, did it begin at the same time at the shortness of breath?
Yes, doctor.
Okay. And did you ever feel any chest pain or
No,
only chest tightness?
only chest
Okay.
tightness and
Uh,
some wheezy noisy chest,
with
but
okay.
no chest
Uh,
pain.
okay. And was these symptoms for present for the first time in your life, or did you feel that before also,
I
before
had
that 1 year?
I had a history of childhood asthma, and that went away totally when I was at I was about 9 years old.
Okay, 9 years old. Okay. And since then you have been have well just
I
before
play
that
quite well,
one.
doctor. Yes.
Okay. Okay, that's all right. Well, can you please tell me that did you feel any racing and pacing of your heart?
No.
Okay. And regarding the shortness of breath, well, did you think that there was any problem while sleeping at
No.
night?
No.
Okay. Did you use extra pillows at night, or did you have to wake up at night
No.
due
No.
to this
No.
shortness of breath?
No.
Okay. Did you notice any leg swelling?
No.
Okay. Well, okay. And you told that the symptoms were more or less resolved after taking inhalers. Okay. And since in the last 4 months, can you please tell me now that what your symptoms are now since the last 4 months?
The symptoms like before, but this time the symptoms comes more frequently, and also I have more chest tightness, more wheezy chest, and more shortness of breath.
More shortness of breath. Well, can you please tell me now that is this shortness of breath does this have any variation during the day?
Uh, Variation, yes, doctor. That is one thing that I am now helping my husband for his work. He usually
Okay,
use some hays and for the horses.
okay,
I
yeah,
I have to handle them, and during that time, I feel more shortness of breath.
you're feeling more shortness of breath. Okay, and okay, and do you feel any pain in your chest?
No, I never
Any
feel
racing
pain.
pacing now?
No,
Okay,
never.
okay, okay. And now, do you have to use any extra pillows at
No,
night
no,
or
no.
any legs? Okay, okay, that's all right. And you told about chest tightness also. Are the chest tightness also same that you
Yes,
gets
doctor.
worse
Yes,
while you help your
yes,
husband?
yes.
Okay, and okay, that's all right. And may I know that you have shifted to a new house actually, as you are telling. Well, since you moved to a new house, have you had any episodes of fever or any cough?
No, I have some cough, but no fever.
Okay. And well, can you tell me that uh, where the house where you have shifted, how is it in shape now? Is it an old house or new house? Can you please tell me about it?
It is old house, doctor, and usually we are here for our job. So we staying here for a short time. For this, we rented a house. It is a old house, and it is not well furnished.
Okay, okay. And well, are you working on furnishing him well now? Are you doing anything that varnishing the furniture or
No,
uh, okay, okay. And well, you told that it's an old house. Can I know that whether there is dust present in the house or not?
actually, yes, doctor. It is not quite clean.
Okay. And well, did you do you ever you told that you had childhood asthma? Well, did you know of anything that made it worse? Any allergen like any dust pollen or any food, any type of food or any dust
No,
mite? Did you know of any?
no.
Okay. And may I know that do you have to be exposed to dust mites now? You know if
I have to
any insect?
past, but I don't know about the mites.
Okay, 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 that's all right. It's actually a type of insect, small insects. Okay. So, and may I know some other some personal questions? That do you smoke?
No,
Okay. Do you drink alcohol?
no,
Okay. Any recreational medication do you take? I'm very sorry. It's been personal.
no, doctor.
Okay. Any okay. Any history in the family? Any significant history apart from your mother's heart attack?
No, I don't know.
Okay. 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 Do you yourself have any known disease of past?
No,
Okay. Do you take any medication other than this inhaler?
no, doctor.
Okay. Any allergy to any medication?
No, I don't know.
Any herbal medication?
No,
Okay. And may I know that did you make any travel to any other country recently?
before shifting to my job, I went to North America.
Well, how many months back?
That was more than 1 year back.
More than 1 year back. Okay. That's all right. And okay. And may I know whom do you live with?
Live with my husband, and we have one silver child.
Okay. And I'm very sorry to ask, but I have to ask that do you have any casual relationships other than your husband?
No, doctor, never.
Okay, okay, that's I'm very sorry to ask. And may I know that do you have any? Do you take any pills for your contraception or something like that?
Yes, doctor.
Okay, for how long?
For the last 5 years.
Okay, okay. Well, did you ever have any episode of your leg pain?
No,
Okay. Any pregnancy loss do you have? History of
no,
pregnancy loss? Okay. May I know what about your period? What about your menses? I'm sorry to ask. It's a personal question. But
it's quite
is
normal.
it normal? Okay.
It's quite normal.
Okay.
It comes in.
May I ask you some other questions? Yeah, yeah. Yeah, I'm sorry, but may I ask you some other questions? Do you have a headache?
No,
Okay. Any changes in vision?
no,
Any soreness in your mouth?
no,
Any joint pain?
no,
Any rashes in the skin?
no.
What about your water work?
I haven't noticed any change.
Okay, okay. And your bowel movement?
As usual.
Okay. And
2 minutes,
may I
please.
know what do you do for a living?
I am not doing anything personally, but I am helping my husband with his job.
Oh, okay, okay, okay. That's all right. And okay. And may I know what your concerns are?
Doctor, do I have any heart attack or any heart issue?
Yeah. Well, actually, at this moment, we will have to first examine you properly and assess you. But as long as we have taken your history, it is unlikely that you have been suffering from any heart attack. Okay. But till we cannot be completely sure about it, we have to do some scanning tests, some blood tests as well. But as long as we have taken the history, we think that the symptoms that are bothering you might be due to uh, you're shifting to the new house. Okay. That is actually old one, and it has some dust. So actually, since you have childhood asthma and for the last 1 year you have taken some medication for asthma, uh, these dusts sometimes this contains some dust mite. And you also told that your husband have to do some work with the horses, some mages, I think, and you have to help with him with that also. So this can also actually make your asthma worse. Okay. However, we have to be sure by involving chest doctor and other specialists and doing the tests. And as soon as we make the diagnosis, we will get to you as soon as possible. Is it all right?
Okay, doctor.
Any more concerns?
Another thing, doctor. You've said that ask me about pills I am taking. Is there any relation with my pill and with my symptom?
Well, there can be. We cannot completely deny this at this moment, but it's unlikely. However, when we run the tests, we can be much more sure about it. And if we find out that it is the cause, then we will actually advise you about the pills, how to take it, or whether to take it or not. Okay.
Okay, time up.
Okay.
Okay, so what is your diagnosis?
Okay. I think that since they are moving into the house, I think this can be exacerbation of asthma due to dust mite, I think. Okay. And also, uh, I think this can be a case of some extrinsic allergic alveolitis also. Okay. Since there is some maize involved with the horses. And uh, and since she takes some pills, it can also we can also uh, keep chronic pulmonary embolism in our differential list. And rarely uh, a chronic heart failure can also be a cause.
Okay, so how will you investigate her?
Okay. And for the beginning, we have to do some routine blood tests like CBC, the inflammatory markers like ESR and CRP. We will also do the spirometry and peak flow measurement. And then we have to go for chest X-ray PA view to see whether there are any fibrotic changes for extensive allergy alveolitis or not. And we will involve the pulmonologist to be sure whether she needs an HRCT scan or some scanning or D-dimer level as well. And I think, and also we might have to go for radio RAST test. Okay. So RAST is to find out the precipitant, whether this dust mite is causing this or not. Okay. To find out the allergen responsible.
Okay, but for this, suppose is the case of occupational asthma. Is there any advice you would like to give the patient, or any specific any test that you would like to perform?
Yeah, I think he should maintain the peak flow diary actually. Okay, if there is any occupational asthma, peak flow diary have to be maintained, and she can
What do you expect on peak flowmetry diary?
peak flow meter in case of occupational asthma. Uh, there should be increase in peak expiratory flow on his off day, on his or her off day. Okay.
Okay, and any other test that you would like to perform?
Uh, for occupational asthma,
Yes, for occupational asthma or for diagnosis of asthma.
uh, reversibility test, I think.
Yes, reversibility test. Okay, suppose it is a case of occupational asthma, or suppose it is a case of as bronchial asthma. So how will you manage that?
Okay. First of all, I will have to educate the patient and counseling him well, and then I have to be precise about the precipitants which may make his or her asthma worse, and advise him to avoid those circumstances. And then we will go for preventive measures, like we might go for inhalers, which at the beginning can involve only beta 2 agonist, like salbutamol or something like that. And in the later stages, we might involve inter, intraarticular, steroids also, and we might we should use leukotriene antagonist, okay, like montelukast as a preventer therapy. And in case of acute exacerbations, we should use nebulized bronchodilators, and then rescue therapy with prednisolone. Okay.
Okay,
And if in rescue therapy, if that doesn't resolve, then we might also go for intravenous magnesium.
okay, you told everything, but that was not necessary for now. So what do you
Okay.
expect on a spirometry with the patient of asthma?
Spirometry, I think the peak flow meter should be less. Okay. The peak flow uh, and the FEV1 should be less.
Okay,
If
do you
FEV1,
expect obstructive pattern or restrictive pattern?
yeah, in asthma obstructive pattern, FEV1 by FVC ratio should be less. Okay.
Okay, thank you.
And okay, and after beta 2 agonist deliver administration, in case of asthma, there should be around 20% rise, and okay, sorry, about 12% rise. But in case of COPD, usually there is no rise.
Okay, then come to your history taking. History taking was fine, but I think you should be more systematic for her shortness of breath.
Mm.
You have asked almost everything: onset, then
Yeah,
character,
yeah.
then associated symptoms, then timing, then eliciting factor, then aggravating relieving factors. But I think you haven't asked about severity. How severe is this condition? Is it affecting the daily
Mm-hmm.
life? Did she ever
Yeah,
need any hospital admission?
yeah, yeah, yeah. Yeah. Mm.
Okay. And also, she had cough. You haven't asked about cough. Well, was it productive or non-productive? You could have at least asked it.
Yeah, yeah, yeah,
Okay. Noisy chest and tightness of breath, and I cannot remember that you have asked about any night sweats or any long-term rise of temperature.
no, I didn't. I should
Fever.
have asked night sweat block.
Yes. And after that, your history taking was somewhat good. You asked about any symptoms, current symptom and previous symptom was the same or not. And also during the symptoms, she said that she feels more during working hours when she helps her husband. You should have asked that did she ever used any type of mask or any protective equipments? Did they help? And also you could have asked that did she notice that working days or going home
Mm,
couple of days makes it worse or better, though
mm,
she may not have any off days because
mm,
she is helping her husband, and her husband may work every day. So
mm,
in the meantime, did she take any break from this type of job, and did she
mm,
notice any feeling of oil during that time?
mm,
And also for salbutamol fluticasone, how frequently does she need to take those? Because salbutamol is a pro-rata dose, so she may take it more frequently, or she may take usual dose like once or twice daily, but that is not helping her.
mm, mm,
So you could have asked that have you tried taking more frequent doses?
mm, mm.
Okay.
Okay. Mm.
And
Well, I think okay, okay. It's complete.
okay, and after that, in the past history, you were haphazard. You asked the personal history very earlier.
Yeah, yeah.
I told you past history. I told you past history, and after that, you haven't went for the drug history. You went to the personal history very early.
Yeah, yeah.
Completing personal history, you went for drug history,
Yeah, yeah.
and family history. You went for after going for the family history of going for personal history. And I cannot remember that you asked about any pet at home.
Yes, yes.
You asked about housing. That was fine.
Yes. Okay.
And also, she has a history of travel to North America. And which part was it? Any near the Mississippi area? That did
Mm,
symptoms started after coming from the
mm.
travel, or did she
Okay.
had she had any history of exposure to that is called bat or caves?
Okay. Yeah, yeah. This should all have been asked. I think. Yes.
Okay, overall your other discussion was fine. Okay, you wanted
Okay.
to tell
Okay.
something or add something?
No, no. All these things have to be. But I think that is raised temperature and night sweats, weight loss, and I think weather preference. I think this can be part of systemic examination. Am I right? Because thyroid problems or this type of problems can be present in almost any symptom.
Okay, but this lady has cough, shortness of breath, so this can be a case of, though unlikely, can be a
Maybe.
case of tuberculosis.
Mm. Yeah, yeah. No, no. I'm asking you that raised temperature, night sweats, weather, weight loss, weather preferences. Can these big questions be asked as systemic evaluation in almost every patient?
Yes, yes,
Because I think these are actually systemic, and most patients can be involved by these
yes, yes.
problems. Yeah, yeah. So that's one thing. And okay, and
And
again, that
and
travel was very important.
when telling the investigations, I think you should tell the at least expected finding of these investigations. Like you are doing spirometry, so you are suspecting that FEV1 is
Mhm.
less,
Okay, okay.
and
Mhm.
also FEV1 by FBC ratio should be less. That is obstructive pattern.
Okay, okay. Mhm.
So what do you expect? At least you can tell that I expect this.
Okay. Mhm.
And I think
Uh,
for the management, you told everything, and I think you
mhm.
could tell the multidisciplinary team, because she has also needs some uh,
Mhm.
occupational departments input, because
Mhm.
her job is also a risky job for with asthma, so they can give her advice if she cannot totally avoid this job.
Mhm. Mhm. আচ্ছা, ওকে। হুম, এটা তো ইম্পর্টেন্ট, তাই না?
Yeah.
ঠিক আছে, ঠিক আছে। I think it's